Tantor Audio, a division of Recorded Books, presents The Vaccine-Friendly Plan, Dr. Paul's safe and effective approach to immunity and health from pregnancy through your child's teen years, by Paul Thomas, M.D. and Jennifer Margulis, Ph.D. Narrated by Bob Souer. Publisher's Note: this audiobook is packaged with bonus material, which has been included on the first audio and MP3 CD. If you downloaded this audiobook in a digital format, please visit Tantor.com and type The Vaccine-Friendly Plan into the search box. Follow the link to the books page, then click on PDF Extra 1. When prompted, enter the access code HEALTH to access the bonus material. Introduction. Though I was born in the United States, I grew up in Rhodesia, now called Zimbabwe, in the 1960s. My parents were young missionaries with the United Methodist Church, and my family moved to Africa when I was just 5 years old. My sister Mary was 4, and my mother was pregnant. My little brother Bruce and my little sister Jean were both born in Rhodesia. Our first home in the village of Arnoldine was built out of sun-dried bricks. We had no running water, no electricity, no glass windows. It was crowded, loving, and chaotic. I loved it. My mother, who had studied at Vanderbilt University, was a nurse, and our home quickly became the de facto health center for the village, with parents showing up with sick children in tow, hoping we could help them. My family spent 15 years in Africa. By the time I was in my teens, I had seen more deaths than most Americans, perhaps even my fellow doctors will see in their lifetimes. It was not uncommon for mothers and their babies to die during childbirth in our village. Newborns, especially those with malnourished mothers, succumbed to infectious diseases. Car accidents, malaria, and fulminating infections that did not respond to treatment also claimed too many lives. As my Congolese friend Odette said years later, tisking and shaking her head, Africans die young. But there was one death that hit me harder than any other. My playmate Tarai was only 3 years old. One day very suddenly, Tarai got a high fever. The whites of his eyes turned red, and he became lethargic and stopped eating. He had a rash all over his body. When his mother took him to the hospital in the capital city, the doctors told her Tarai had measles. When she heard the news, my mother didn't worry much at first. Measles were so commonplace that in her generation, other mothers made sure their children got exposed whenever it was going around. She had had measles herself as a kid and had seen it many times as a nurse. Tarai died the next day. I eventually came back to the United States to finish my education and went to the Geisel School of Medicine at Dartmouth College, where we were taught about the history of vaccines, the victory of the eradication of smallpox, and the elimination of polio from the Americas and most of the world. I knew firsthand how important vaccines were. If Tarai had been vaccinated against measles, he might not have died. After 4 years of medical school, doctors in America are required to do what's called a residency, 3 to 5 additional years in a subspecialty. By then, I knew I wanted to become a pediatrician, and every time I gave a child a vaccine or spoke to parents about the recommended vaccines, I was glad. I knew those vaccines would help the families I was caring for stay safe and healthy. I was still in residency when the Hib vaccine was first introduced. Haemophilus influenzae type B is a strain of bacteria that can cause severe infections like meningitis and even death, especially in small children. Meningitis is difficult to diagnose correctly because the symptoms are a lot like the flu, which is caused by a variety of influenza viruses. The only way to know if a child has meningitis is to test the spinal fluid with a spinal tap. You insert a tiny needle into the lower back until you reach the sac with fluid that covers the spinal cord. If the fluid looks clear, like water, the child does not have meningitis. If the fluid looks slightly cloudy, chances are it is meningitis. We would send the sample for testing and know in a few hours when the lab reported the cerebral spinal fluid results. Back when I was doing my residency, children's hospitals, if mine was any indication, had several cases of meningitis at any given time. That first year the improved Hib vaccine was introduced, in 1987, rates of pediatric meningitis at our hospital dropped by half. Before the Hib vaccine, about 20,000 children under 5 came down with life-threatening infections caused by Haemophilus influenzae type B every year, and about 1,000 died. These days, there are fewer than 25 cases of Hib a year, and no deaths. Vaccines save children's lives, make families safer, and have helped me be a better doctor. And back then, I could not imagine any reason not to give each and every vaccine as directed by the Centers for Disease Control and Prevention, CDC, and the American Academy of Pediatrics, AAP. These two organizations, full of hard-working, highly educated, caring, and smart scientific researchers and doctors, put out childhood vaccination guidelines that saved lives and helped children, and I saw it happening firsthand. In the fall of 1988, I began practicing medicine at Emmanuel Children's Hospital in Portland, Oregon, armed with knowledge, hope, enthusiasm, and a full head of brown hair. I was a new pediatrician, excited to help my patients stay well and live healthy lives. But as the years went by, I started to notice something that troubled me. The children in our practice who followed our advice were not as healthy as they should have been. Instead, they were sick more and more often. Daisy had a severe rash that just kept getting worse. Jorge was struggling in school with attention and learning issues, his mother in tears as she described what a hard time he was having. Luke had such high sugar in his urine that when we got the test results back, I called his mom on her cell phone and told her to go to the closest ER immediately. Luke had type 1 juvenile diabetes and was in danger of dying from hyperglycemia and encephalopathy. He was only 4 years old. A little girl named Julia developed a peanut allergy so severe she went into anaphylactic shock because of a spot of dried peanut butter on the shelf at her preschool. By the late 1990s and into the beginning of the 21st century, every pediatrician in America was starting to see what I was seeing, an explosion of chronic diseases and other conditions among America's children, including food allergies, attention deficit disorders, childhood anxiety, childhood asthma, childhood depression, eczema, gastroesophageal reflux, headaches, ear infections, neurological disorders, sinus infections, lung infections like pneumonia, urinary tract infections, and virulent strep throat, to name a few. Many of these problems have arisen because our children's immune systems are increasingly compromised. The modern American diet, with toaster pastries washed down by sugary drinks for breakfast, shrink-wrapped deli meats and potato chips for lunch, and canned spaghetti or fast food for dinner, is not only devoid of nutrient-rich vegetables, it is full of toxic additives, like mold inhibitors in bread and petroleum-derived colorants in just about every food made specially for children, from sweetened yogurt to pickles. Combine this unhealthy way we have been duped into feeding our kids with the fact that American children do not get enough exercise or outside time and are often vitamin D deficient, chronically sleep-deprived, and sometimes overly stressed out, and you lay the foundation for a weakened immune system that will succumb much more easily to disease. Add to all this the toxins that abound in the air, soil, and water, as well as in the furniture we sit and sleep on, the cleaning products under our sinks, and the plastic containers that leach chemicals into our food, and you have what amounts to the perfect recipe for compromised health. As if that's not enough, we doctors make this bad situation even worse by over-prescribing antibiotics and being quick to recommend drastic interventions and prescription medications without adequately informing ourselves or our parents and patients of the side effects. And then there is the devastating rise in autism. Jack was an active child with blonde hair, a smattering of freckles, and sky-blue eyes. He came in for his one-year checkup full of energy, squirming off his mother's lap and particularly interested in opening the drawers on the side of the exam table. I could see by his behavior and from talking to his mom that Jack was a healthy, active, normally developing youngster. The next time I saw Jack, he was 2. My nurse practitioner had taken care of his 18-month well baby visit and accompanying shots. I flipped through Jack's chart before opening the door. he had been developing normally and meeting all milestones. But when I walked in this time, I could see instantly that something was wrong. Instead of actively exploring the room, 2-year-old Jack sat silently in his stroller beside his mother, shaking his head back and forth, looking at nothing. He was completely absorbed in his own world. His mom told me that Jack had even lost interest in food. He would sit for hours lining up his toy trains. She explained that some time between 18 months and this visit, Jack had stopped making eye contact. Yes, he banged his head against the side of the crib sometimes, as if he were in pain. And though he could speak a few words at 12 months, she no longer really understood the noises he made. I could not make a definitive diagnosis. I would have to send the family to one of our evaluation centers for that, but I suspected that the disengaged, unsmiling toddler before me had autism. How could it be that a completely normal 1-year-old in my care had become severely delayed and neurologically challenged by the time he was 2? It wasn't just Jack. The rise in autism was impossible to ignore. It simply was not there when I was in medical school at Dartmouth in 1981 through 85. I only saw a couple of mild cases of autism in children in residency in 1985 through 88. But by the time I was working as a pediatrician at Westside Pediatrics in the late 1990s and early 2000s, I was sending one child almost every month to a specialist for suspected neurological disorders. What was going on? Why were so many children in my practice who were following my advice becoming so sick? Most conventionally trained doctors like me will tell you that no one knows definitively what causes autism. They will also tell you autism is a disorder for which there is no hope and no cure. And, in the same breath, they may blame you for your child's autism. They may say it is in your genes or that there is an underlying genetic reason. They may mention the 2014 study published in the American Medical Association's Psychiatry Journal that found that children of fathers over 45 are 3.5 times more likely to have autism than children of fathers in their 20s. Or the 2014 study published in Journal of Perinatology that showed that children of women who were obese during pregnancy have a higher risk of autism. I debated the rise in autism endlessly with my colleagues. Though I believe they were as worried as I was, it was, sadly, easier for many of them to shrug their shoulders, adjust the stethoscopes around their necks, and deny the evidence in front of them. We're just better at recognizing these kids today, they would say, clearly trying to convince themselves, when I brought up Jack and my other patients' unusual medical histories. What became obvious to me was that some environmental factor or combination of factors was negatively affecting the health of the children in my care, triggering the increased incidence of so many vague but nonetheless scary symptoms: migraines, severe anxiety, gastrointestinal upset, unusually early onset allergies. And what also became increasingly obvious was that some children were being poisoned in some way, or were developing an autoimmune reaction in which their own immune system was attacking their brains, or both. Lead is a remarkably useful and versatile metal that was once a key component in everything from face powders to paint. As anyone my age can remember, I was born in 1957, lead was also added to gasoline in the United States. Though this metal was ubiquitous and its use dated back to ancient times, it wasn't until the last 3 decades of the 20th century that we really started to understand how harmful it is to human health. It took decades of research and an explosive, albeit ongoing, controversy, but Americans finally accepted the uncomfortable and inconvenient scientific findings that too much exposure to lead affected our children's brains, IQs, and development. Indeed, we now call lead exposure lead poisoning. A small amount of lead is usually not harmful, but the more lead a child is exposed to, the more likely it is to cause neurological damage. Not every child exposed to high levels of lead will be irrevocably poisoned by it, but the more we have studied lead, the more scientists have come to understand that it has a negative cumulative effect on children's growing brains, and that the amount and the timing of the lead exposure have a lot to do with the severity of the symptoms and how they present. When I was a pediatric resident, we were told that a child could have up to 20 micrograms per deciliter of lead in the blood. That recommended number went down as the years went by, and by the mid-1990s I instructed parents that a child should have no more than 10 micrograms per deciliter of lead in the bloodstream, half the amount we had previously believed to be safe. Today we have a new standard for lead safety. Doctors now believe that there is no safe dose of lead, and we tell parents today that even 5 micrograms per deciliter is cause for concern. What does this mean? It means that for over 20 years we were telling parents not to worry about something toxic in the environment that could actually damage their children's developing brains. And then there are antibiotics. Though some bacterial infections can and will get better on their own, antibiotics are one of the miracles of modern medicine. Among the best things my mother was able to bring to Arnoldine were antibiotic ointments and oral antibiotics. Some diseases that once killed thousands of vulnerable people, especially children, are virtually non-existent these days, in large part because of the discovery of antibiotics. But in recent years, the overprescription of antibiotics has led to the development of superbugs, antibiotic-resistant bacteria like MRSA, methicillin-resistant Staphylococcus aureus, that are devastating to human health. One recent report by the British government predicts that this global problem will lead to as many as 80,000 deaths and may transform minor surgery and routine operations into high-risk procedures. In my profession, we have been talking about the problem of the overprescription of antibiotics for more than 20 years. But despite being aware of it, doctors continue to prescribe antibiotics unnecessarily as much as 50% of the time. It took me years to realize something I wish were not true, but which you cannot ignore if you want to have a healthy baby in America today. Our government officials and a handful of well-positioned MDs who advise them have ignored some of the most important peer-reviewed studies and most relevant scientific information about immunity and health, both during pregnancy and throughout infancy. Some of the recommendations we make today simply make no sense when you look at the science or the lack of science. Some of what we are ordering parents to do is doing more harm than good. A baby named Jimmy was born with what is called unfolded antihelixes. The antihelix is the ridge curving up the middle of the ear that makes it lie back alongside the head. So his ears were dished forward, like Neil Patrick Harris in Doogie Howser, M.D. Harris later had his ears surgically corrected, and Jimmy's parents wanted to do the same to spare Jimmy from being teased in school. Their pediatrician said it would be easier to correct Jimmy's ears when he was still a baby than it would be later, and referred the family to a plastic surgeon. The plastic surgeon sat down with the family to review the risks and benefits of the surgery. Among other things, he explained that any time you put a child under general anesthesia, there is a rare chance of complications, including a serious allergic reaction, which affects about 1 in every 10,000 children, and even death. Doing due diligence, he told them there was a slim possibility, very slim, that Jimmy would not wake up from the operation. When Jimmy's mother heard that, she changed her mind about the surgery. She looked at her baby and decided to leave his ears the way they were, reasoning that no cosmetic intervention was worth any risk of her baby dying. Her in-laws disagreed, urging her to get something done about those ears for years afterward. Like the operation to correct Jimmy's jug ears, every medical intervention involves some risk, and every time we consider a medical intervention, we have to weigh the risk of complications against the risk of doing nothing, and against the benefits of the procedure if it is successful. If Jimmy had had a serious medical problem for which he needed general anesthesia, like an infected appendix, his parents and doctors would have been much more willing to take the small risk of complications associated with putting him under general anesthesia. In this case, I think Jimmy's parents made the best, safest, and most evidence-based decision. Recent experiments in young primates and other animals confirm that Jimmy's mom made the right call. We know now that anesthesia can kill brain cells, diminish learning and memory, and cause behavioral problems. At the same time, if the medical intervention is necessary and the chances of the intervention being successful are high, then the risks associated with the intervention are often worth taking. Whether you are agreeing to surgery, an antibiotic, or a childhood vaccine, it is much easier to go along with what the doctor orders than it is to decide for yourself. The appeal of authority is reassuring. The same holds true for the doctor. It is much easier for the doctor to go along with what the CDC recommends and the states mandate than to do his own independent research and weigh the pros and cons himself. How do I know this? Because I used to be that doctor. But 30 years in pediatrics have taught me that it is time to change our bias favoring one-size-fits-all medicine and, more specifically when it comes to immunity, all vaccines all the time, to a more nuanced and skeptical approach. I give vaccines in my office every day, but I also recognize that we need to be vaccine-wise, that all vaccines on the CDC schedule may not be right for all children at all times. My approach puts parents in the driver's seat, allowing them to tailor the best and safest vaccine schedule for their children, while at the same time making lifestyle changes that support the immune system, reduce toxic exposures, and lead to the best possible health. We doctors must remember that vaccines are preventative medicine. They do not cure an illness, they give a boost to an already healthy immune system, so the body is less likely to succumb to illness in the future. I would argue that this makes it even more imperative that we have proof that the vaccines we are recommending are both necessary and safe. Doctors are healers. The vast majority of us would never knowingly do something to put a patient in harm's way. When one of our patients has a vaccine reaction or a bad outcome of any kind, it is very hard for us to admit it. It feels personal. After I realized that vaccine damage could actually happen, I went into a depression for over a year, admitted my colleague, the late John Hicks, M.D., a pediatrician in private practice in Los Gatos, California, who specialized in children with autism and other autoimmune disorders. I had the same experience in 2003 when the facts finally overwhelmed me. Listening to multiple presentations at a medical conference about autism, I realized we had poisoned a generation of children with a mercury-derived preservative called thimerosal that was in the majority of childhood vaccines. Since safety is tested vaccine by vaccine, no one from the CDC had ever calculated the cumulative amounts of mercury in the childhood vaccine schedule at the time. In a flurry of emails dated June 29, 1999, and later brought to the attention of Congress and the public through a Freedom of Information Act request, Peter Patriarca, M.D., then Director of the Division of Viral Products at the Food and Drug Administration's, FDA, Center for Biologics Evaluation, wrote to his colleagues that it was not rocket science to add up the amount of mercury contained in vaccines. Conversion of the percentage of thimerosal to actual micrograms of mercury involves ninth-grade math, he pointed out. What took the FDA so long to do the calculations? Why didn't the CDC and the advisory bodies do these calculations while rapidly expanding the childhood immunization schedule? Thimerosal has mostly been phased out, but it is still present as a preservative in multi-dose flu shots and one brand of the meningococcal vaccine, and it is also found in residual quantities due to the manufacturing process of some of the tetanus, diphtheria, and DTaP vaccines. I would later discover we have continued to make the same mistake with the high amounts of aluminum currently found in many childhood vaccines. As you'll hear in this book, the current CDC-recommended childhood vaccine schedule exceeds the toxic limits of safe aluminum exposure. This book is a comprehensive guide to childhood health and well-being, offering parents not only balanced information about vaccines, but also everything else you need to know to keep your child safe and healthy. It is organized chronologically as we walk you through the well baby visits, interventions, and inoculations your child is expected to receive from the time she is conceived to the end of her teen years. Giving you balanced information from other credible, experienced, and well-established medical doctors, as well as from my own experience, this book will help you make the most educated and evidence-based decisions about which vaccines your child needs and when. This book also explores how we may be repeating the same mistake with vaccines that we made with antibiotics. We may be overusing a medical intervention so drastically that the cure has, in some cases, become more dangerous than the disease. In 1983, the CDC recommended 11 total shots for children spaced out between the ages of 2 months and 16 years to protect against 7 diseases. In 2015, the CDC recommended at least 50 shots starting within the first hours of life and continuing to age 16 to protect against 16 diseases. What this means is that today's children get more than 4 times as many vaccines as they did 30 years ago, most of them in the first 18 months of life. In the meantime, nearly 300 other vaccines are currently under development, 170 for infectious diseases, 102 for different kinds of cancer, and 8 for neurological disorders. To what extent is overvaccination contributing to the rise in chronic diseases and other health problems among America's children? To what extent is overvaccination a trigger for autism? Have we taken an unquestionably good practice, childhood vaccination, and turned it into something that is actually causing harm? Even just asking these questions is controversial for a pro-vaccine doctor like me and a pro-vaccine parent and researcher like my co-author Jennifer Margulis. Yet it is urgent that we ask and answer these questions, and that we devise a safer and cleaner vaccine schedule so that we can protect our children against both infectious and chronic disease. We do not believe in throwing the baby out with the bathwater. We do not think the problem is vaccines with a capital V. If you are looking for an anti-vaccine book, you should stop listening. We believe that vaccines have saved countless lives, and we believe that they have an important place in modern medicine in America today. We are concerned, however, that some vaccines are not safe for some children, and that our current CDC schedule may be harming more children today than medical professionals and public health officials are willing to acknowledge. This book begins with a radical premise. We believe that parents, not public health officials, not the government, and not even doctors, are actually the best people to be making health decisions for their children. We also believe that parents must have all the available information they need to make an informed choice. In 2008, I opened my own practice, Integrative Pediatrics. A year later, I founded a pediatric urgent care clinic so families could have access to good medical care after hours and on weekends. In the past 7 years, I have developed a vaccine protocol that has yielded excellent results, keeping children safe from both infectious diseases and the immune disruptions and brain disorders that plague so many American kids today. I have more than 11,000 children currently in my practice in Portland. More than 2,000 of these kids were born into the practice. Those following my protocol are among the healthiest in the world. I refer to my protocol as a vaccine-friendly plan, a wellness plan that includes some vaccines and offers parents scientifically proven and common-sense ways to support their child's immune system. I am a vaccine-friendly doctor, a term first coined by pediatrician Robert Sears, M.D., and now used by parents to identify medical doctors who do not dismiss families that choose to forego some or even all vaccines, understand the importance of spacing out vaccines, and practice patient-centered medical care. This book is based both on my extensive experience as a practicing pediatrician treating routine childhood illnesses and urgent pediatric cases, and on the information my co-author and I have gleaned from vaccine-friendly doctors across the country who, like me, have been quietly providing more individualized care with great success. We give you the most current information about the known risks and the benefits of vaccines to empower you to make informed decisions for your family. Our goal is to ensure that America's children are vaccinated safely and that we still maintain high enough community immunity to infectious diseases that we protect everyone in our society. It was too early in the morning for the phone to be ringing. I answered it groggily, thinking it must be a patient emergency. The voice at the other end of the phone was telling me something I couldn't process. Tsitsi, my African sister, had just died of a massive heart attack. Tsitsi was Tarai's sister. After Tarai died, Tsitsi and I grew up together in Rhodesia. Highly educated and with no job options in Zimbabwe, Tsitsi and her husband Weston eventually moved to New Hampshire. Weston died from colon cancer when he was only 38, leaving Tsitsi a single parent of 4 small children. And now...
Sample complete. Ready to continue?